Assalamualaikum and good evening to my honor Madam Sulaila and my friends. I am Muhammad Danial beyond Azman, a neurologist from the World Health Organization, and I will talk about type of headache. Headache disorder characterized by recurrent headache are among of the most disorder of the nervous system. Headache itself is a painful and disabling feature of a small number of primary headache disorders such as migraine, tension type headache, and cluster headache. Headache can also be caused or occur secondarily to a long list other conditions such as medication overrush headache. Headache can be caused by many factors, and women experience headache especially migraine as much as 3 times more than men. How common are headache disorders? Globally, it is estimated that prevalence among adults of the current headache disorder within the last year is 50%. Half of the quarters of adults aged 18 to 65 years in the world have headache in the last year, and among those individuals, 30% or more have reported migraine. Headache on 15 or more days every month affect 1.7 to 4% of the world adult population. Despite regional variation, headache disorders are a worldwide problem affecting people of all age, races, income level, and geographical areas. There are three types of headache. Firstly is migraine, secondly is tension type headache (TTH), and lastly cluster headache. The first type is migraine. Migraine is a primary headache disorder. Migraine most often begin at puberty and most affect those aged between 35 and 45 years. It is common in women, usually by a factor about 2:1 because of the hormonal influence. It is caused by an activation of mechanism D in brain that lead to release of pain-producing inflammatory substance around the nerve of blood cell and of head. Migraine is recurrent, often lifelong, and characterized by recurrent attack. Now the second type of headache is tension type headache. Tension type headache is the most common primary headache disorder. There are two types of tension type headache which are episodic and chronic. Episodic tension type headache occurring on fewer than 15 days per month is reported by more than 70% of some population. Chronic tension type headache occurring more than 15 days per month affect 1 to 3% of adults. Chronic tension type headache can be unremitting and some much more disabling than episodic tension type headache. Episodic tension type headache attack usually lasts a few hours but can persist to several days. Tension type headache often begin during the teenage years, affecting 3 women to every 2 men. This headache described as pressure or tightness, often like a band around the head, sometimes spreading into or from the neck. In graph 1 and graph 2, migraine and tension type headache prevalent peak in a middle age, which is 40 to 49 years for male and female. It is because at this point that is beginning to drop, yet the impact on the patient is not reduced. Interestingly, unlike other people who suffer from primary headache as a kid, the beginning of the migraine in adulthood is likely to be due to the hereditary or family reason. it is still a possibility. According to the study, migraine symptoms intensify over these years. The frequency of the headache day has been found to rise year after years, peaking in late adulthood. This correlate with the transformation of many individuals from episodic to chronic headache, such as shown by the increase in the number of headache attacks. Although the specific cause is unknown, the risk factors include prescription abuse, obesity, the presence of mental symptoms such as depression and anxiety. Last but not least, female had the highest percentage of migraine and tension type headache suffered at all age, as shown in the graph 1 and graph 2. This because of the hormone influence can contribute to the development of persistent headache or migraines. From Northwestern Medicine neurologist Charulata Pinaga MD says that migraines are more common in males during the childhood. However, after the impact of estrogen begins, female preponderance begin to climb. She continued this provide the basic understanding of why the headaches are more common, longer lasting and frequent in women. As conclusion, to sum up, headache are the one most common issue among women, and if no action is done by government or the society, this will be uncomfortable tragedy. Today it is about how headache influence our world, and not everyone realize that is the severe condition that may steal our someone life. In my opinion, anyone experiencing new or more frequent headache should seek medical help. Any medicine that comes with troubling symptoms is severe or prevent a person from going about their everyday activity should be treated by a doctor. I really hope that we can prevent this event from happening to our future generation may live in a relaxing atmosphere where they can exchange kindness and caring. There are several methods for avoiding headache. Firstly, you might exercise, meditate, and pray, and spend time with loved ones and perform other enjoyable activities. Secondly, you can make a strategy to improve some of things that cause you to get tense. Psychotherapy and stress management courses are also important to examine. Lastly, you can also check into biofeedback, which teaches you how to control a specific aspect of your body, such as heart rate and breathing, to reduce the stress. That's all for me. Thank you.